Hey, Armin here, and in this video we're going to talk about injuries, the basics of what to do, because they're going to happen, or you may already have an injury and you're learning about what to do about it because stuff happens, unfortunately. So one of the first steps is when you have an injury is to rest it. These are kind of obvious things, but you need to execute them if you want to get the result. So rest it. So let the swelling or whatever it is, the injury, start to heal and get healed up before you start working on something again. So rest it up until it feels better, and then when you start back, you need to start back at a lower weight, slower process, and see how it feels as you're moving, as you're getting back into working the area that got injured. And so my suggestion is when you get an injury and you're starting to come back to training, especially with weight training, is stay high rep. Now, the reason you want to stay high rep is because it gets blood flow to the area. If you use heavier weight, what that'll do, it'll cause the swelling to kick back up again, because that's what probably aggravated in the first place, is just the pressure that was on the injured area. So with high repetitions, so when I'm talking about high repetitions, I'm talking 20, 30, up to 100 reps actually, so really lightweight, but to get a lot of blood in there to help the healing of the area that's injured. And there's a lot of different approaches you can take to that, but they don't need to be heavy weight. You just want to get the function of the area back. That's what you want to do. So resting it, start back with light, high rep. Don't do a lot of sets on it. Just do maybe one, no more than two. Personally, one is probably all you're going to need. And then see how you respond, see how you feel. And if it starts feeling better, good sign that you're making progress. Then you can start cutting the reps back and slowly start adding some more weight back in until you get back to where you were, which will happen pretty quickly. I've done it myself. It'll happen pretty quickly over time. So to give you an example, I was playing basketball many years ago, and I did a lot of heavy squatting, and I pulled my hamstring. I just felt it really burn, and I didn't tear it, thank God for that, but I pulled it really well, and the burning sensation was horrible. So then I had to ice it, which we're going to talk about as well. And so since we're talking about that, let me just throw this in there. I iced it. You want to ice for 15 minutes and then rest 30 minutes to let the coldness come off, because you don't want to get frostbite. And then go again for 15 minutes and just do 2 cycles. That typically is what you want to get that swelling down. All right, so getting back to my hamstring story, it was pretty painful. So I couldn't do anything and for I don't know, several weeks, which psychologically, when you get these injuries, it's really frustrating. You feel like you're getting a setback, your muscles are shrinking, there's all kinds of psychology that happens. But it is what it is, so you got to be strong mentally and deal with it. So as the leg started to feeling better over time, and again, it was probably about 10, 12 days, then I decided, okay, well, I need to see what I could do to work it. So I got on the leg curl machine and just did one leg only, and I did like hardly any weight just to see if I had range of motion. Which when I did it, it was okay, but I could still feel a little bit. So what I ended up doing is I said, okay, I'm going to use really light weight. I'm going to see how many reps I can do with this current range of motion until the leg starts to feel uncomfortable or fatigue. So I started doing. I got up to, I don't know, again, it was like 1 plate on the leg curl machine. And I think I got like 20 reps, and I could start feeling, a little more discomfort. So I was like, okay, I'm done. And I did that. I gave it a full 7 days to recover and did it again. Then the next time I did it, I was able to get 35 reps. So, but I'm feeling better. I'm like, okay, cool. And so then it only took, I don't know, about 2 weeks of this high rep scheme. I got up to 100 reps. Then I knew, okay, this is much better. And then when I started adding the weight, again, I added a little bit of weight and dropped the reps down. So like the first time I trained my hamstrings to work that area, I ended up getting only 50 reps, but it was variable fatigue, but no pain. So that's how you want to approach any kind of injury with the resistance training. You come back at it, high rep, lightweight, just get that functionality back, and that way you don't get swelling, because if you get the swelling, then it's going to hurt and ache, and then you're going to have to let that clear out. So that's how you want to approach that. All right, and then you want to ice it, again, 15 minutes, and then wait 30 minutes and do another 15-minute ice, and that's it's pretty effective. Now, if you have a rolled ankle, My suggestion is kind of tough, but put your foot in a bucket of ice and again, 15 minutes. Now that's kind of excruciating initially, but it will drop the swelling down dramatically if you roll an ankle, and it'll heal up so much faster. I got that from when playing basketball. It works really well. So if that happens, do that. You don't need to do 2 rounds of that. 1 round of 15 minutes with that, and it's going to be all you really want. But it will help drop that swelling really well. All right, so then another thing you can do is you can do compression, depending on what the injury is. So compression can be elastic bandage you wrap around the area, or you can use a sleeve, a compression sleeve, and that just kind of helps restrict things into one area, and it can help take some of the pressure off as well. Not as I wouldn't say as great a response as other things, but if it gives you relief, then go ahead, try it out. Maybe you got a strained calf. This is something that will help for the calf muscle or a quad muscle if it's been pulled. Keeping it snug and tight so it doesn't get too much movement where it would aggravate it, that kind of thing. All right, then the other one is elevation. So the purpose of elevation again is to help drop the swelling. So you got to get whatever it is. It's like if it's your leg, your knee, or even your arm, that kind of thing. You got to get it at your heart rate level. So like sitting down, raising your leg would help to reduce that swelling, take that pressure off, because when you're standing, that blood pressure is coming right down, and that's going to keep that swelling up. So if you elevate it, then that swelling can be the blood flow can be distributed a lot more evenly and take that swelling down. But again, common sense, and you can look these things up as well. But these are the different approaches that I help my clients with if they do have an injury. Okay. Next, pain relief. So with pain relief, a lot of people want to use the ibuprofen, the Tylenol, or whatever's over the counter, typically manufactured by a drug company, or even do a prescription for pain. So what happens when you take these different, like ibuprofen or Tylenol, if you take them over a period of time, and I see people stay on these for a long time, which is totally amazing to me, but it'll start to jack up your liver enzymes, and you start getting elevated liver enzymes, and that starts creating a problem as well. So there's a nice workaround that you don't have to deal with that's pretty effective. Now, is it going to be 100% effective to like Aleve or ibuprofen? Well, you'll have to make that decision, but try it because it's much safer for you. So what that product is, and I've used it a lot for myself and for clients, is called Formula 303. You can get it at a health food store or buy it online from Amazon, and just get you a small bottle of it. And what Formula 303 is, it's basically valerian root and a few other herbs mixed into that. And that has a calming effect, and it helps to reduce inflammation. But it's all natural, and so you can take it a little more often, and it won't jack up your liver enzymes. And it can make you sleepy too, so you want to kind of keep that in mind, but a lot of these things tend to do that. Not a lot sleepy, but you'll feel somewhat sleepy because it can help with sleep at night, depending on what you're dealing with. But I found that Formula 303, like I'd injured my back. Basically, I was squatting too heavy, and over the years, when you squat heavy, you got the bars on your back. Well, what happened is I'm doing like 455 for 12 reps kind of thing. And as you age, things deteriorate. So the spine started compressing from the weight on my back, and that was causing problems. It was putting pressure, causing problems with the cartilage as well. So since I couldn't do that, then that's when I had to decide, okay, well, what am I going to do to alleviate this problem? And so I got adjusted by the chiropractor, but then I had a client that recommended the Formula 303. And I got to be honest, I didn't think it was going to do anything. I was like, I'll try it. And I was totally surprised how effective it was. And then it helped clear my back up within probably 8 to 9 days. Now, I still had some treatment with the chiropractor to help loosen the pressure up, but I was really impressed with how well it worked. And then when I have clients use it, they're really surprised as well. So it is a very effective pain reliever. And again, you can take it every 3 hours or so. So, I would use that versus the other. I mean, you can still use the other, but if you have chronic issues, then you want to understand it's going to mess with your liver enzymes, and that's not a good long-term strategy. Okay. So after all that, if none of that works, you're still having problems, or there's a lot of immobility or not complete range of motion, then that's when you want to seek rehabilitation strategies with, a therapist, physical therapist, because they're going to be the most knowledgeable. Sometimes chiropractors have some knowledge with that, but you want to get some rehabilitation strategy based on, do you need therapy, or can they give you some exercises to help improve the area through these exercises? Which, again, when you do any kind of rehabilitation or exercises like this where you're going to be stretching, always make sure you're warmed up, nice and warm, or a little bit sweaty, because that makes the tissues more pliable and workable. You don't want to do any kind of rehabilitation or stretching cold, because it can actually make the area, because everything's cold and tight, and you start to stretch, it can actually create more problems. So another tip that I've learned the hard way as well. But if you're warm and sweaty and you start doing the stretching and the isolation exercises, by warming up, you're going to get a better response. All right. Now, lastly, if you're doing an exercise and all of a sudden you're getting pain, sharp pain, or it doesn't feel right, or you're feeling grinding, or something's not feeling right, stop what you're doing and rack it, put it up, and then check yourself to see if your range of motion is going to be impaired. And if it is, don't keep doing the exercise. You gotta rest it up, and you gotta figure out what happened. So don't keep training. There's guys that they want to go out and they think that after they do an injury, they'll go ahead and just keep training, keep using the same heavy weight, and all that doing is making an extremely long-term injury last a lot longer than it really should. So you gotta read your body. If it's not feeling right, seek help to find out what could be the issue. A lot of times, as an example, ligaments, if they get out of place, it can have a dull achiness of the area because they slipped. So what I'm talking about here is you have ligaments that lay in a little groove here, like a little slot, like this. Well, sometimes they'll slip out and get on the edge, and this will swell up and cause a sensitivity. Now, the good news is you let that swelling drop back down by not aggravating it. It'll slowly move back in and lock back in. And then you start to train again, and the muscle will work around, the muscles around it will cause it to tighten it back up and keep it in the spot that needs to be in, just as an example. And that I found that to be very effective with a lot of people. That's with knee and elbow and shoulder issues. That works really well. So let the swelling drop, and then all of a sudden when that ligament slips back in, all of a sudden you feel pretty good. And then again, start back light, work the functionality of the exercise, full range of motion, that kind of thing. Okay, so hope you got some good takeaways here on the injuries and the basics that I typically recommend. If you have questions on that, or you have an injury, pop a question in there, and we can discuss it and see if we can help you out. Other than that, I'll talk to you again real soon.